afternoon, Miss Anju. My name is Kyla Fraser. Thank you so much for taking time out of your day to join us for this suicide prevention and awareness campaign. So before we get into the questions, would you mind just telling me a little bit about yourself and your background?
Um, Good afternoon, and thank you for having me here on this day. My name is Anju Vivekanandaraj. I'm a registered clinical psychologist. I'm also the founder of a private practice firm called Inner Peace Psychotherapy and Counseling Services. And I offer individual and group counseling for various mental health issues and relationship therapy and couples therapy, and also adolescent-based counseling services.
Okay, thank you. So the first set of our questions will mostly focus on mental health and the system within Guyana. So the first question is, how would you describe the current state of mental health awareness in Guyana?
Mental health awareness, I would say it has been much more improved since the post-COVID time. And I believe during the COVID and after COVID, there has been more of a awareness towards mental health, various mental health issues. And there has been a lot of initiatives in play after the COVID. So I would say the mental health awareness has improved, but still there is a huge gap that needs to be filled, and it's a long way to go about. And specifically to mention, I would say some of the schools have started certain mental health related approaches and initiatives. And so that's a new thing. And I have also seen many initiatives that are taken towards creating that mental health awareness by the ministry and on the public sector level. So it has improved post-COVID.
Thank you. So can you provide some examples of how the mental health resources are being utilized to their full potential in Guyana?
Okay, and as I mentioned, like with the increased mental health awareness, I can see people are much more open in reaching out and getting the professional help, even though still it's a long way to go about in tackling with the stigma, which is still persisting. And I would say in terms of a full potential, I can see people are utilizing many of the resources and facilities that are being established on a public sector level. As I mentioned, there is a really well-functioning mental health unit with the Ministry of Health, and it's much more accessible in terms of the free services that they offer. So I know that they are, pretty busy as people are more approaching and reaching out for help. And I also know with the Ministry of Human Services, we have the suicide hotline and hotline for domestic violence. And so people are utilizing those resources. And I'm also happy to hear that the New Amsterdam Hospital, again, which is on renovation, so we can see much more of an improved facilities and establishments over there. So it's seen that people are utilizing these resources. But if you would say if it is to full potential, I would say that's a question, right? As always, there's a gap. So I would say it has improved and more people are utilizing these resources.
Okay, thank you so much. You are indeed right. It has not reached its full potential, and maybe hopefully we will get there very soon. My next question is, how prevalent do you see the stigmas, surrounding mental health in Guyana?
Stigma is still there. Stigma is still there surrounding the mental health in Guyana. And I would say some of the major concerns surrounding the mental health is the confidentiality aspects, the trust that comes with that confidentiality. And it's still, many people are fearful of, the people in their surrounding, whether that's within the family members or friends or colleagues, knowing that they are getting some sort of psychological help. So they don't want people to know that they are reaching out, getting some sort of psychological support. So still there is a lot of stigma and concern surrounding, the mental health. And people are still afraid of how they might be viewed, the judgments surrounding the, mental health aspects. And how would my family member treat me once they know that I'm having some sort of mental health issues? How are things going to affect my workplace conditions, my job? So it's a lot of concerns surrounding the mental health, and so there is still a lot of stigma. But I'm seeing more and more people, being open to sharing their mental health issues and emotional challenges. They're open to getting help. So that's a positive thing. But still, we have to start with addressing the stigma. And just to add on here, I would say the important thing is normalizing mental health. And normalizing mental health needs to start at every level. It needs to happen at schools. It needs to happen at home. As a parent or as a sibling, you need to, talk about your mental health challenges or any emotional challenges. Be open, encourage your people in the family to talk about it. So normalizing that in workplace is also important. So normalizing mental health and also bringing in aspects of emotional and social learning in schools, even from the very early beginning of elementary and nursery level, would help to address the stigma.
Yes, I wholeheartedly agree with your opinion. We should definitely start, especially within the schools. So, as a therapist or clinical psychologist, how do you see your role in changing the narrative around mental health?
Okay, and I would say that as a psychologist, we can do a lot when it comes to changing that narrative or even creating a much better access and awareness to the community. So I would say constant research is something that I would say is needed as healthcare professionals, not just psychologists, psychiatrists. We have mental health counselors. We have various NGOs that are, functioning within the capacity of mental health. So, constant research based on what is the need of the society and the community, the mental health needs. That is something that needs to happen. And so that is an area where I see myself, changing the narrative when it comes to mental health, and also bringing in new developments when it comes to the treatment and management of mental health issues. So even though we have improved resources and facilities, I would say there are new developments and approaches that are being used in different other parts of the countries. So it would be good to bring in those and also to work on the level with policymakers so that we can, help in creating the needed mental health policies that will facilitate the use of or implementation of, newly developed and new approaches when it comes to the treatment of mental health aspects.
Okay, thank you. So those are my main questions. I'm now going to ask you some questions relating specifically to your organization, Inner Peace. Okay? So can you just tell us a little bit about, what Inner Peace is, what exactly you guys do, and what inspired you to start that organization?
Inner Peace Psychotherapy and Counseling Services is it's a private practice firm, and we offer psychotherapy and counseling services for various mental health issues and conditions. So we deal with all sort of mental health issues and disorders. And we also offer couples or relationship therapy. We also offer trauma and grief focused therapy, and also teenage and adolescent focused counseling sessions. And the reason, I started with Inner Peace Psychotherapy and Counseling Services is I initially started my practice working with different hospitals and clinics here as a consultant psychologist. And something that I realized, one major thing that stands out for me is the facilities that we have when it comes to the hospitals and clinics are much more focused on a clinical aspects that could be with regards to physical conditions and everything. So the facilities that we have in order to provide the counseling and therapy in hospitals and clinics is not something much more comforting, I would say, to have a therapy or so forth. So basically, to put it like, the rooms would be looking like a doctor consultation room. And some of the, thoughts that that were shared by some of the individuals are that, like, it looks too clinical, right? It doesn't make them feel comfortable. And you would understand that as a hospital and clinics, you will have a lot many people in the place. And that makes it difficult for the person to even feel safe within that room, even if it's an individual room. So you have all these challenges that comes with a big hospital or a big organization in itself. So that was one of the major reasons that, and there is a demand, a need for, mental health management and treatment facilities. So with that in mind, I wanted to have a private firm that is much more focused and specialized just for providing the counseling and psychotherapy services. And even my place is not something that would look clinical if you ever get a chance to visit. So it will not look clinical. So I wanted a place that is much more comfortable, much more cozy, where people feel, easy, at ease, and comforting to start with and continue in the process of a therapy. So based on the needs and demands and based on what the clients would have shared over the years, led me to start with this inner peace psychotherapy and counseling services.
Okay, that is very nice and very insightful. I'm so proud of your organization and your work that you do. My next question is, so your clinic, offers a wide range of services from individual therapy to couples therapy, as it's stated on your website. So how do you tailor your approach to meet the diverse needs of your clients?
The approach used differs from one therapist to another therapist. It's in a sense, it's personalized. So on my part, I would say that I use different approaches, different modalities when it comes to different issues that we are dealing with. So it depends on the individual's challenges, what is that they're going through, what is the intensity of the issue. All these will help me determine like what sort of an approach or what modality I'm going to, utilize there. And I'm a person who is also certified in many different psychotherapy techniques, including different branches of CBT, different aspects when it comes to trauma. So I'm certified with EMDR, clinical hypnosis. So it depends on what is the individual person's need. I will be utilizing different modalities. And when it comes to relationship and couples issues or couples therapy, I'm also certified in Gottman's method. So again, I apply mostly that when it comes to relationship and couples challenges. So I would say it depends on the therapist, and also it depends on what is the individual's need and challenges that they are facing.
Okay, so does your clinic ever host free campaigns for those who might not be able to fully, afford full therapy all the time, but maybe need just one session to kind of get an idea of what they're dealing with and how to better cope?
I offer free consultations in the beginning. Like that means even before coming to the actual therapy, like, people call and we have discussion from 15 to 30 minutes of discussion, because many would wanted to brief what they're going through, all right, to give the therapist an idea of what are their challenges looking like, and also to clarify if they have any concerns or questions, they wanted to bring it up. So the initial consultation can be done via phone, which is like about 15 minutes or sometimes more than 15 minutes. So that something happens. It's not something charged. It's free. And even before we start with the actual therapy session. But apart from that, I offer, how can I say, it's like a sliding scale when it comes to the payments for the therapy. So that happens, I do that with the students, any university students, because I have come across many students who depend on their pocket money, in a sense, to come to the therapy services because they don't want to their family to know that they're doing a therapy session. And I'm talking about 18 and above. So for university students, I offer a kind of a sliding scale when it comes to the charges. And apart from this, again, there is from time to time where I offer community services, where I go to different regions. I collaborate with different NGOs and organizations, even small businesses. They try to collaborate where they wanted to offer services for their staffs or their members from the staffs. And so those things are also being done on a regular basis.
Okay. Next question. So on your website, it also states that your clinic provides both in-person and online therapy session. So how has this flexibility affected access to mental health services across Guyana?
It has made it easy for people to access and get help. Definitely, there is a change, where people are reaching out more, even from different regions and different parts of Guyana. And it's something that I personally suggest where in-person sessions are much more effective, which I have seen, it to be more effective when it comes to in-person sessions. But definitely when an individual is not able to come in, if they are from a remote places or if for some other reason, if they prefer online sessions are also facilitated. But still, I would say there is, there's a need where it could be made better accessible for people in remote regions. Even though the online sessions are available, I would say still the internet services, the internet can become a challenge and an obstacle when it comes to really remote parts. So still there is a gap in that aspect.
Okay. So what are the therapeutic methods or inventions that Inner Peace use to support individuals at maybe high suicide risk?
Okay, and high suicide risk, again, we needed to have a proper assessment in place. And I always say it is okay to ask and bring the question, even though the person would not have brought they would not have shared if they have any suicidal thoughts or, suicidal behaviors. So that is something that I always bring up in the initial session to check with them. And it is okay to ask that question. And we also do certain emergency plans, which are being set in place if there is any risk or if they are having any suicidal thoughts or if there is any past suicidal behaviors. Emergency plan is set right from the initial session. And as I mentioned, like there are different modalities that we can be using when it comes to what is the individual's problem. Even though the person might be at risk for suicide or if they're having any suicidal thoughts, the underlying problems can be different. So what are the contributing factors? What are the underlying problems will determine, us as a therapist to choose different modalities based on that. And as I mentioned earlier, one of the very common modalities that is used is with cognitive behavior therapy. And recently we have different other branches of cognitive behavior therapy. And I commonly use something called as acceptance and commitment therapy. So there are different modalities that will be used based on, again, what is the underlying issue that is contributing to the suicidal thoughts or if a person is at a risk for suicide.
Okay. So, as the founder of Inner Peace, what unique challenges have you faced in establishing and running that mental health clinic within Guyana?
I would say it's just like any other services or businesses that are being established here. I wouldn't say there was anything specific or anything overwhelming when it comes to setting up this particular service as my private practice here. So there's nothing specific as to the mental health services, but I would say it's just general like any other businesses or any other services that they are being trying to establish. And again, I would say it depends on the individual's perspective, right? So if you understand this is a common issue that any business who's trying to set up, their firm here are going to face, and you just expect and you understand what are the challenges, and you try to find a way to go about with that. I would say so. It depends on individual outlook and individual's perspective. So I would say it's just the general challenges and obstacles. It's nothing specific to has setting up mental health related services.
Okay, thank you so much for your time. In wrapping up, is there any advice that you'd like to give to the general public as it relates to mental health, seeking mental health, and specifically suicide as it is Suicide Awareness Month?
Um, I would say I'm glad to see that you're part of the Young Influencers team. And so I'm seeing a lot of initiatives that are happening, especially from youths. And I would say, that's one of the biggest part where I would encourage every youths and young professionals, no matter what profession you're in, you can do a lot, and you can all be a part of bringing that mental health awareness. And also, and as I said, as an individual, it's all about normalizing and accepting mental health as any other physical challenges or physical conditions that they might be facing. So that's another part. Normalize, encourage to talk about mental health in many different ways. That could be through all these different programs and events. It could be just even on a day-to-day basis, you're able to talk and share about your mental health aspects. And also, it needs to start from a very young and early age. That normalizing is something that needs to happen from very young. So, as parents and as family members, they have an important role in making sure that that confidence and that space, the safe space, is being given at home for children from young age to talk and to accept mental health issues and mental health challenges. And also to give options to people, no matter whether that's your kid or whether that's your friend or whether it's a colleague in a workplace or an employee, giving them multiple options as to how they can go about with getting help and dealing and managing with their mental health issues. So providing options is also very important.
Okay, thank you so much for your time. Maybe in the future we'll be working with you again. Do have a wonderful day.
Thank you so much.